What do you think about the pods? Are they useful?
I think they're very useful. We, over on the medical side, have used them not only for, kind of a therapeutic activity task to put somebody on, but kind of as a screening or, I guess, kind of looking at somebody how they might approach an activity or a task, their thought process.
Okay.
Also using it as, I guess, kind of a behavioral screening tool. What is their impulsivity like? In working with the head injured population, we kind of have to look at the behavioral aspects of how an activity or something that they are doing, plays into, their reaction. And so I guess the impulsivity as well as the frustration tolerance is a good kind of key as to how they might react in a situation similar to this that might be frustrating or that might be a little difficult.
At home or at work?
At home or at work.
Yeah, okay, good. 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 Do you think the range of difficulty is a good range? I've had concerns myself that the baby bear chair was, too simple and the papa bear chair was too difficult. What's your sense of that? I
think it depends. It definitely depends on the client and what their difficulty is. For example, I had a client that I was using this with, he has a visual impairment, and so a large part of what I was really wanting to see from him is, what are his scanning abilities when he's using the actual pictures. He also has pretty severe aphasia, and so in terms of reading and following the written instructions was very difficult for him. So even what would be the simpler chair was difficult for him, but it just depends on the type of, I guess, skill set we're working with, and really what we're using the task for. And I think that's another good thing. You can use this, I think, with just about any client in terms of what is the skill set that you're trying to either improve upon or identify as an area of concern. And this was a really good activity for the client to become more aware of, in a real task, my scanning abilities, I'm not using the tasks that I was shown or the strategies I was informed of that might be helpful in the real life setting. When we set him down on a scanning activity and he knew we were specifically working on scanning, he did great. Oh. But in an activity where he's more focused on the actual task and not that, hey, I have to really focus on my scanning, it was really important, and it was really good for him to see. I just totally missed that left side of the page, or that left side of the chair because I'm not scanning.
So this was a person with like a hemianopsia that had some difficulty. So it was really not just a test of assembly, but a test of how he goes through the manual and how he reads instructions and follows instructions. Well, that's
the gentleman too, there was some upper extremity weakness, and this was a good activity for him to see how weak maybe it was. Putting some of the conduit pipes fit a little more snug than others, and so he could tell when he's trying to disassemble the chair, this is a little hard. I don't know why I can't get these pieces apart. So from a physical standpoint,
sounds like it was a self-discovery experience for him.
It was, and at first when we were doing this, he had been in kind of the maintenance field prior to, so this was, this is going to be real easy. I'm going to have no problems with this whatsoever. So it was good for him to I guess discover that on his own versus from a therapy standpoint, and we're having to I guess give news that's one wouldn't want to hear from just a therapy session. He got to experience that and increase his insight on his own. It depends on the client. For him, his main goal is he does want to go back to work. So in that aspect, yes. And I took more of an observant approach initially with him, so he could kind of feel, and for me, so I could kind of see where, how he would tackle this task. But for him on the job, he didn't have somebody, over him, and I think that's the other good thing about the pods, that there's a grading kind of a grading, you can kind of min assist, max assist, mod assist, so that is really helpful to kind of help from a therapy standpoint. How are they improving? How much assistance did I have to give this time versus when we did it 2 weeks ago? from a productivity level as well, I'm looking at, how quickly was he able to assemble the first chair, initially, and then 2 weeks later, we do it again after we've done some more therapy in between. So I guess it really just depends on the client. I do know that there's some clients that I've worked with, I don't think I'd want to take it from a supervisory standpoint because they need that comfort. They need to know that I'm standing right there, and if they have a question, they can ask it right then.
So they'll need more support, so they're really not ready to be in an employee-employer kind of relationship with you.
Right.
I think that's a great point. Yeah, good.
I think, and we kind of talked a little bit about, the other, I guess, simulated work that you've created, the swag. I think I like the spin that you've put on the pods. I guess from a therapist standpoint, we want to make everything very individualized and very purposeful for the client. Sometimes I felt if we put the male population on the swag, they would, oftentimes we'd hear it's too clerical. I'm not going to work in an office. This is a little bit more, I guess, geared towards the male population, that if they're going in, or if they've worked in a field or something a little bit more masculine, for them to feel like I'm putting something together and I get to see a real end product versus something that would be, more paper and pencil. So I think, again, this just brings another spin to, the same type of approach that you're trying to do, trying to simulate real work activities and making it very purposeful, but we're hitting the more male population, and oftentimes I think that's what we see kind of lacking in some of the activities that us OTs are trying to use. I mean, not all our male population wants to work on, some of the grooming stuff, and they tend to think it's I guess it's a little too feminine on some of the things that we do, and budgeting and those types of things. So this definitely brought in an aspect of that we could use, I think, more with our male population. They took to it much easier than some of the other therapeutic activities we'd use.